Hi everybody, this is Lisa, and today we're going to be talking about Chapter 11, Environmental Safety. So when we say what is environmental safety, it's really being able to identify and correct potential hazards that are in our workplace. The important thing that we need to remember, no matter what healthcare facility you work in, there are policies and procedures written that you are required to follow. They are somewhere located within your office or close at hand, and just because you don't know them is not an excuse. You are supposed to be aware of what those policies and procedures are. So you always want to know where they are, and you want to make sure that if there's an update, you're following up with that. OSHA, we talked a little bit about in a previous chapter. They have a lot of things to do with protecting employees in the workplace, but they also have a number of regulations that apply to workplace safety. Okay, keeping our workplaces safe. When we talk about the different types of hazards that are available in healthcare, you can go to page 260 in your text, or if you have an ebook, you can go to table 11-1, and there's a number of them. So these are the common workplace hazards. First of all would be a chemical hazard, and we're going to either be exposed to this and we can breathe it in. It can be absorbed through the skin, or we could ingest it, eat it somehow. Examples of these things would be chemotherapy agents, disinfectants, cleaning solution, alcohol, anesthesia. All of those are considered chemicals. So think about bleach or some type of cleaner that you're using. It really can affect your breathing. For MA students, you're going to be smelling Sidex, which is a chemical disinfectant. It really has a horrible smell. It bothers me because I have chronic bronchitis, and it really triggers that. So when I work around Sidex, I wear a mask because I know it's going to bother me. There are environmental hazards in the workplace, and these are going to be unsafe conditions. So this is going to be things like slip, trip, and fall hazards, cramped workspaces, inefficient equipment, inadequate equipment maintenance, and fire or electrical hazards. So when you think about that in the workplace, we're looking at rugs in the hallway that aren't laid down properly. We're looking at water or some kind of fluid on the floor that people could slip and fall. It could be equipment, a big piece of equipment in the hallway that makes it difficult for people to get around. Inefficient equipment, again, if you pick up something and you can see that there is something wrong with it, let's say a thermometer, and it's got a frayed wire, we need to put that out of service. We need to let the supervisor know that this is broken and it needs to be repaired, and put it out of service, because we don't want to be using equipment that's faulty on our patients. And the other thing is fire and electrical hazards. And that's something that you need to be very aware of. This would include things like storing chemicals. We want to be looking at the safety data sheets to make sure we're not storing chemicals that would interact with each other next to each other. So it's really important when we look at those type things that we think about those things ahead of time so we can decrease the possibility of fire. Ergonomics is a big one for us. This is where the equipment that you're using is not ergonomically correct. So that means that it's putting you at risk for musculoskeletal injuries. But it's even more than that. Poor lighting, excessive vibration, and noises are also considered ergonomic hazards. There is a classroom in the tech building, and it's 109, that actually sits on top of an air conditioning unit, I think. I really don't know what it is. But that classroom vibrates, and it is so distracting. And see, now I know it's an ergonomic hazard, and I could have turned that in. But no joking aside, it was very, very irritating. The big thing for us is going to be, again, when we're moving patients or boxes, making sure we're using correct body mechanics, and also the chairs that we sit in, where our computer screens are. Your computer screen should not be at an angle to where you're sitting, because then you're going to get a crink in your neck and it's going to be uncomfortable. So all of these things fall into that ergonomic category. Infectious or biological, these can cause an infection through, again, breathing them in, direct contact with the skin, a puncture wound, or eating or drinking something. So we're living this right now with the coronavirus. You know, we're supposed to be, it was 6 feet, now I hear it's 13 feet apart. So this is going to be when we are concerned about bacteria, viruses, fungus, or any other living organisms that are around. Physical hazards are things that can cause physical injury and tissue damage. And those could be things like radiation, noise, explosive objects or substances, and which is oxygen. And we're going to be talking about that. Psychosocial, this is stressors in the workplace, causing anxiety, emotional fatigue, and burnout. We need constant support. We need to know coping mechanisms, especially with things that are happening in an emergency situation. Somebody walks in with a gun into our office. We have this coronavirus. Now we're all stressed because we're all going to catch it. All of those things are psychosocial hazards within our area. And the last thing is workplace violence. And this is any physical assault or verbal abuse that occurs during the course of performing your duties. There's a number of things that this includes. So being pushed, being hit, or restrained, of course. Spoken to in a loud or demeaning manner. That is considered sexual or workplace harassment, cursed at. Now, some of these things we could actually put in different categories. So we could go back to the psychosocial area as well, or possibly under the physical. So question number 1, inadequate equipment maintenance is what type of hazard? Is it chemical, infectious, or environmental? Hopefully you put environmental because it's an unsafe condition in the workplace when we don't maintain our equipment. And if you've ever worked someplace, you know that they want to use it until it's on its deathbed, but we really need to put it out of service when it's not working correctly. So again, remember, chemical hazards are toxic effects through breathing, absorption through the skin, eating, skin contact, those type of things. And infectious hazards are things like bacteria, viruses that could cause an infection. So safety guidelines. There's a number of good safety guidelines that are in your text. So the first one they talk about, the first thing they talk about is these focus on prevention. If we can prevent an injury or an incident from happening, that's what we want to do. We don't have to want to fix it. We want to prevent them. So if we know and we look down and we see that a rug's flipped or there's water on the floor, we do something about it immediately so we can prevent an accident from happening. So one of the safety guidelines is going to be moving safely. So again, they don't want you to run. And that's important because in an emergency situation, you will see people take off running like a banshee. That is not good because first of all, it startles patients. And the second thing is you can try to turn a corner and run right into somebody and really cause harm. So you need to get there quickly, but you don't need to run. Stay to the right of the hallway. Again, there is a traffic pattern. Right is going one way, left, the other side of the hall is coming towards you. Remove loose rugs. If you're opening a door, open it slowly. The last thing you want to do is open it very quickly and hit somebody in the face with the door. Use handrails when you use the steps and don't run up and down the steps. Don't carry uncapped syringes or any sharp instruments in the hallway or between rooms. We're not saying that you can't have them. We just can't carry them in an open situation. We would put them in, as far as sharp instruments, we would put them in a container, put a lid on top of it, and then we transport them through the hall to the dirty room where we would be cleaning that equipment. And again, we want to watch for wet or greasy floors. You also want to dress for safety. If you have long hair, you do want to wear it back for a number of reasons. You could get caught in a piece of equipment, but it also could fall into a wound and get all that disgusting gook in your hair. And you don't want that. So you're going to need to wear it pulled back. You only want to wear one post earring in each ear. And the first time somebody grabs an earring and rips it out of your ear, you will understand that. And I've seen that more times than I can count. People get confused. They don't realize what's happening. Or they go to reach for something and they hit your earring instead of your shoulder. And they pull and there goes that earring. So a nice post in the ear. That way, even if they do get near your ear, it's not going to pull through anything. Shoes should be enclosed, especially if you're working in an area that has sharps, and you shouldn't have more than 1 to 1.5 inch heel. Our jewelry should be limited to a smooth wedding band. And we love to wear our jewelry, especially if you've just gotten engaged or anything like that. But when you put your gloves on and off, it actually does two things. It starts to get a powdery buildup or residue in your ring, in the setting of your ring, but it also loosens the diamond. When my daughter-in-law, when my son proposed to my daughter-in-law, she's a nurse, and so she wanted to wear her engagement ring. Well, one night she looked down and the diamond was gone. Here, they went through every room, every trash can, and they found it inside of a glove. So please be careful with your jewelry. The other thing is that cruddy stuff can get caught inside of there, and then it can be infectious itself. The other thing is fingernails. We have to keep our fingernails short, which means not above the tip of the finger. And that's so we don't scratch or tear our patient's skin. If you've ever worked with older people, you know that their skin can become very, very thin, and it's easy to tear it. So we need to keep our fingernails short. And the other thing is no artificial nails. This comes from the CDC. You actually can get bacteria between the artificial nail and your nail, and then you can actually pass that infection on. Now, in saying that, I'm not going to say you're not going to see them in the workplace. But as students at Allegheny College of Maryland, we follow CDC policy. So no artificial nails. When we're working safely with our patients, we have to remember that our patients are our primary concern. When we're working, if somebody asks you to do something that you have not been trained to do, the answer should be no. If you are not trained to do it or have received any type of training, you should not be doing the procedure. The other thing is, make sure you have the correct patient. We identify our patients, so we make sure that we're doing the testing on the right people. So if you've ever been in the hospital, you know that they scan your bracelet, then they scan the package or the meds or the IV or whatever it is. Even when you go in for outpatient, to get your blood drawn, you have to have a bracelet put on. They have to scan it, and then they have to scan the orders and scan the little stickers. Again, making sure that we have the right patient as we're doing those procedures. Make sure that the patient has given consent. Don't just assume because they're there that they're agreeing to that. You might want to walk in and say, "Mrs. Jones, I'm here to draw some blood. Is that okay?" If she said, "No, I'm not. I don't want anybody drawing my blood," then we're going to say, "Oh, okay. Well, I was, this was ordered. I just wanted to check." And if they say no, we cannot hold them down. Remember, assault and battery. They have the opportunity to refuse because of patient autonomy. Observe patients closely and report any type of changes that you may see. We don't ever leave patients unattended on an exam table. I say that under my breath. We kind of do sometimes. If it's a patient that we know is steady, if they needed to get down, they could. Anybody that may have difficulty walking or getting around, we want to sit them in a chair first, and then if they need to go to the exam table, we'll get them on the exam table when the doctor comes in. Once they're done, we'll get them back down, and then we can do what we need to do. The last thing we need is somebody falling off that exam table and cracking their head open on that concrete floor. If you are working in a place like ambulatory or acute care or long-term care, and even some doctor's offices have electronic tables now with peds as well as adults. Make sure when you're finished that you properly position that bed or that exam table. Don't leave it at a high level. It's okay to put it up if that's easier for you to draw. I always used to bring the beds up when I did blood gases because it was not as hard on my back. But I made sure before I left that that bed was all the way down in the correct position it should be. And the last thing is keeping your area clean, neat, organized. This is a pet peeve of mine. If you are going to be a mess, then I need you to work somewhere where I'm not, because even though my office is a mess, I like my workstation clean. And I've seen a number of people go in to drop an injection. They get the syringe, they throw the paper on the side, they get the needle, they throw that paper on the side, and then they pull up the injection, they're ready to go give it. And instead of cleaning up that garbage, they just let it lay there. That drives me nuts. Clean up your space. And the other thing is, if you use the last thing, whether it be the last tissue, whether it be the last needle or the last ear probe for a thermometer, replace it. Do not leave an empty container for someone else, because they're going to come in with the assumption that that's going to be full, and it's not going to be, and it's going to irritate them. So on page 261, it talks a little bit about physical and mental changes that can increase the risk of injuries and accidents for our patients. And again, some of these are common sense. So when we have changes in vision, they may not be able to see unsafe conditions, or they're not able to judge distances. So let's say they really aren't seeing well. There's water on the floor. Everybody else has seen it, but that person can't see as well. So they walk right in that, slip and fall, and they hurt themselves. Okay. What we do need to do, again, with people with changes in vision is we need to identify ourselves when we walk into the room. We also need to make sure that the hallways are unobstructed. This is really important. We don't want to be stacking boxes and equipment and all kinds of stuff in the hallway. It needs to be open so our patients can walk through. Changes in hearing, again, this is something that we see, and a lot of the times, both as patients get older, we'll see that patients who are having trouble hearing, they may not hear warnings or something that's approaching, a cart, or some type of equipment. So we really need to make sure we're careful as we're pushing things to make sure, again, we're staying to the right and we watch where we're going. Well, we talked a little bit about this in the last chapter. If we're talking with somebody who has a hearing issue, we want to face the patient. We want to speak clearly. We do not need to yell. That does not help them one iota. Altered neurological function. This could be tremors or shaking, a balance issue, and all of those things can increase the risk of falls. And so when somebody has those balance issues, we need to be close by to make sure if they start to trip or fall, we're there to help them before they hit the floor. Okay? The other things that we need to worry about with that is decreased sensation. So if you think about diabetic patients, they actually get neuropathy. So in their feet and sometimes in their legs, they can't feel that. So they don't know if there's a pain, if there's an ulcer forming, what it may be. So we need to be very careful and watch for people that we know have these issues, because they can develop a blister and it can very easily go into gangrene and maybe the loss of that limb. So we need to be extremely, extremely careful. Change in blood vessels. Again, if we start to see some occluding of the arteries, patients can get dizzy when attempting to stand up, which is again going to increase the risk of falls. So we just need to be cognizant of this. We tell our patients to get up slowly. We're kind of there just in case. We're not going to hold them and, but in case they do need us, we're right there and we can grab their arm or their, or something to steady them. Slower reflexes. So with this, it's, if something's hot, we immediately pull away. Well, as we get older and the neurons takes a little bit longer for them to connect to one another. If we touch something hot, in our young days, we snap our hand right back. It may take longer if you're an older adult. And so we need to make sure that we're watching to see if patients can move out of a dangerous situation quickly. Okay. This one is where we would provide patients and family with information about the possibility of unsafe behaviors and a way to safeguard their home. Usually what they'll do is they'll send an OT, an occupational therapist in to do an evaluation of the home and say, listen, you need to get rid of these throw rugs, you need to do this, you need to do that, and that will make this a much safer place. And that is part of their job to do that. Changes in mental function, people getting confused or can get forgetful, and they can lose their sense of good judgment. And so we have to be aware of that. Again, giving family information about possible issues with medication. There's a number of home health services and resources that are out there. And again, we want to safeguard that home because we want that patient to be safe if we are going to leave them in that in their home. And the last one is taking medication. Some side effects of medication are dizziness, visual disturbances. There's so many different side effects of medication. And 6 people could take one medication and everybody has a different reaction. So it's really important that we remember if we notice anything like that, that the family call us immediately. So if they start to see a mental cognitive change, they're going to call us and let us know. If they're dizzy, their vision's kind of funky. We're going to monitor their medications. Again, after watching the video, they don't know which medicines are which. So maybe they're pulling up their own meds and they aren't doing it correctly. And so maybe they're taking the wrong medication, which may cause some of those symptoms. So it's really important that we tell our patients' families to watch for that. Question 2, which of the following is the best approach when asked to perform a procedure on a patient that you are not trained to do? Do you want to do the best you can? Do you want to have someone explain it to you? Or do you not agree to do it? And I'm hoping and praying that everybody answered C, do not agree to do it. If we have not been trained or received adequate training for that skill, we should not be doing it. So we're going to talk a little bit about protecting ourselves in different situations. Now, I know we didn't talk about Chapter 10, which is standard precautions, those kind of things, because I know that's going to be taught in different courses. Either the orientation to lab, it's going to be taught in the lab class itself, as well as the clinical classes. But one thing is, you follow standard precautions. I don't care if the patient looks like there's nothing wrong with them, you still wear personal protective equipment. If you're doing something invasive, we're going to wear gloves. If it's something that we need to wear a mask for, we're going to wear a mask. So follow standard precautions. Don't leave drawers open or doors open, because I'm going to tell you, and I know you've probably all done it, you whack your leg or your knee or your head when somebody opens that and you're standing there. So please make sure you close the drawers, and truly, either the door needs to be all the way open and pushed up against the wall, or it needs to be closed, one of the two. Because if it's only halfway open, that can be a hazard for people who have visual disabilities, because they may not be able to see that it's there. And that causes some issues. We do not refrigerate food with specimens or medications. Now, this was always a big joke, because when I first started in healthcare, it wasn't standard precautions. It was universal precautions and transmission methods and those type of things. And I will never forget, I had just had one of my children, and they said, do you want a popsicle? And I said, oh. I said, sure. I said, but where do you keep popsicles over here? And they said, well, we keep them in the freezer where we put the placentas. And I thought, No, I do not want that popsicle. So we really should not. And that's one of the first things when they know Joint Commission is coming for a visit, they make sure the refrigerators only have specimens, medications. There are very specific uses for different refrigerators. So don't put your food or drinks into a refrige that has specimens or medications. They really don't like us wearing our uniforms outside of the office. And there's a couple reasons for that. You know, just think you've been in there, people have hacked and coughed all over you, and now you're taking it outside. So a lot of times we'll tell our students, bring a change of clothes. If you have to come back to the college, you need to change out of your scrubs because we don't want to spread everything that was in that office that morning to us. So that's kind of important. Keep your floors clean. If you break something like glass, and it happens, you know, you're drawing blood and you drop a tube of blood and glass breaks and the blood's there, you need to make sure you clean that up. And there's really cool kits for that. And what they come, and they're inexpensive. They're like $3. It comes with a solidifier. So we sprinkle the solidifier over the blood. And so it just sucks it up and it makes it much more thick so it's easier to pick up. It has gloves in there. It's got an apron in there. It's got a little scooper. So we do not ever pick up broken glass with our hands. We pick it up with a scooper and then we would put it into a sharps container. Do not throw broken glass into the trash. That's a huge hazard for the housekeeping people. So all broken glass should go in the sharps container. Okay? If there is something that's unsafe, please report it immediately. We talked about incident reports the last chapter or the chapter before. I don't remember. But you need to report it and you need to report it immediately. We're going to tell them the circumstances, what happened and how it happened. You know, was there water on the floor and the patient fell? Were they dragging their scarf and they tripped over their scarf? That's very important because that's going to depend on then whose fault it is. Was it the patient's fault they fell, or was it our fault because we didn't maintain the floors properly? We want to put the date, time, and location. If there's anyone who witnessed that event, they need to write down their statements. Any hazards that contributed to a fall, we are going to give care to that person. So let's say they fell and cracked their head open and they've got a nasty cut on their forehead. We're just not going to let them sit there and bleed. They may need to go to the emergency room, but we're going to stop that and provide that quick care for them in order for them to be transferred and be checked out. Workplace violence. So we talked a little bit about that, but NOISH is the National Institute for Occupational Safety and Health, and they actually define workplace violence as violent acts including physical assaults and threats of assault directed at a person on work and on duty. Healthcare workers are more at risk than any other profession because of aggressive patients and family members. Now, I'm thinking police are pretty high up there, but I do know that we take a lot of stuff from patients and family. The other thing is there's the highest rate of violence against healthcare workers are either in psychiatric or substance abuse facilities. And again, this makes sense. People who have mental health disorders, you know, they're not in they're having difficulties and they're not in their right mind. So they may lash out. The same way with substance abuse. Tell somebody no, they're not going to get what they wanted, and they can become very, very violent. So it's important that you know, if you're going into one of those two areas, realize that there is a very high level of violence and that you may be exposed to it. Using offensive or threatening language. Psychological trauma. And when we talk about psychological trauma, this is when we are traumatized by what's going on. I mean, if you have somebody that you're working with and they are constantly cussing at you and saying nasty things about you and, acting like they're going to hit you, that can be problematic. That can cause a lot of stress and trauma in someone's life. Actual injuries, things that actually happen. And then the other thing that we need to think about is homicide. That can happen. People come in with a gun because they're angry, their parents died, and nobody did what they were supposed to. You've read it, I'm sure, at least 10 times, that somebody's come in and killed people because their parent wasn't well taken care of, or, because the drugs weren't there. So please be very, very careful when, you're working in these type facilities. When we have workplace violence around us, it can actually result in negative organizational outcomes, which means the employees are going to have a low morale. There's going to be a high turnover rate. People don't want to stay there and work. Why would you want to work in an office or a facility that is nothing but drama when you're there? It's not worth it. And also it increases errors because people are so stressed out, they make errors because they're not thinking clearly. So again, important that we're recognizing that and that we're trying to maintain a nice department or area, that we're not threatening each other, we're not, holding each other captive, calling each other's names. That's extremely, extremely important. Prevention or decrease of violence. This is going to be on page 264, or for those of you who have an ebook, it's table 11-3. It talks about 3 different kinds of designs: environmental designs, administrative controls, and behavior modification. So under environmental designs, this is when we can actually develop a signaling response. So if there's something that's going on, there may be a code word that's used, or there's a hand signal that's used. You'll see that as we go. Install security devices such as metal detectors. Cameras are huge anymore. You just need to have them so you can watch what's going on. Have security walk you to your car at night. We do that all the time for our evening students. And it talks a little bit about designing a triage area and other public areas to minimize the risk of assault. Okay. Now, employer or administrative controls. That is designing staffing patterns to prevent personnel from working alone and to minimize patient waiting time. So the longer a patient has to wait, the more angry they get. And so we need to get those patients in and get them out. The restricting movement of the public in hospitals. You'll notice now you have to check in a lot now, and you have to have a visitor's pass, or you don't get through the door. I did notice that when our daughter was in the hospital, we had to show our IDs. We had to have they had a picture ID for us. Again, we were in the NICU, but they were very, very cautious about that. And a system for alerting security when there's a threat. And again, that may be getting on an intercom and saying code 99, code 33, whatever it may be, or code yellow, whatever. It's just a coding system that you work with. And question number 3. A patient is very upset about the care she received. She begins to escalate in volume and curse at you. What should you do? Should you take her to a private area to avoid disturbing others? Should you acknowledge her feelings? Or do you tell her to calm down or you're going to call security? Well, hopefully you answered that you were going to acknowledge her feelings. We need to be careful, and it kind of explains this. We need to say, I am so sorry. I can see you're very angry, and I want to help you take care of this situation. Because if you put yourself in a room, I understand why you want to pull somebody in there, but now you're with this patient who's really angry and you're by yourself and you're stuck in that space. And just threatening them with security is going to send them off the deep end anyway. So again, just acknowledge their feelings and see if there's anything you may be able to do to help the patient with what's going on. And that is the end of Chapter 11, Part 1.